Can self-assessment be done using GAF? The Global Assessment of Functioning Scale is a tool used by mental health professionals to evaluate a person's overall psychological, social, and occupational functioning. It provides a score that reflects a person's level of functioning, ranging from severe impairment to superior functioning. This scale is particularly relevant for individuals with post-traumatic stress disorder, or PTSD, as it helps clinicians understand how symptoms impact daily life. Now, you might wonder if self-assessment can be done using the Global Assessment of Functioning Scale. The short answer is that while it is technically possible, it is not advisable. The GAF was specifically designed for clinicians to use, not for self-reporting. This means that it requires professional judgment to accurately assess symptoms, social interactions, and occupational performance. Individuals may struggle to make these evaluations without the necessary clinical insight. Research shows that even trained professionals can have variability in their GAF ratings. This inconsistency means that self-assessment could lead to even greater inaccuracies. Studies comparing clinician-rated GAF scores with self-reported measures indicate that while there may be some correlation, self-assessment often fails to capture the full complexity of a person's functioning. For those with PTSD, the severity of symptoms and functional impairment can be difficult to evaluate accurately without guidance. Another challenge is that the GAF combines symptom severity and functional impairment into one score. This can make it hard for individuals to assess their overall functioning without bias. Personal insights may be clouded by emotional states or lack of awareness about the impact of symptoms on daily life. Because of these limitations, self-assessment using the GAF is generally not recommended as a substitute for professional evaluation. Instead, clinicians often use the GAF alongside other validated self-report instruments and clinical interviews. This combination provides a more comprehensive understanding of a person's functioning. In the context of PTSD, where understanding functional impairment is crucial for diagnosis and treatment, the GAF can be a valuable tool for clinicians. However, individuals experiencing PTSD should seek professional assessment rather than relying on self-scoring with the GAF. This approach ensures accurate diagnosis and effective treatment planning. In summary, while the Global Assessment of Functioning Scale measures aspects of functioning relevant to PTSD, it is not designed for reliable self-assessment. It requires clinical expertise to interpret symptoms and functioning holistically. For individuals wanting to monitor their own status, using self-assessment tools specifically validated for PTSD symptoms is a better option.